Welcome to the Learnskin podcast with Dr. Raja and Dr. Hadar, where they discuss all things skin. Skin is fascinating because it affects us in so many ways, like our health, psychology, and how we connect with those around us. This podcast delves into the art and science of skincare. A short disclaimer before we get to the good stuff. Dr. Raja Sivamani and Dr. Hadar Levtov are board-certified dermatologists. This podcast is meant for educational and informational purposes only. All opinions shared do not express the views of Learnskin. Neither this podcast nor any information contained within it are a substitute for professional care by a doctor or other qualified medical professional. This podcast does not constitute medical or other professional advice or services. If you have a medical concern, please consult with your physician.
Hey Raja, how are you today?
Hey Hadar, it's podcast time.
Yes, it is, and I feel the need to get rejuvenated. How about you?
I love it, Hadar. Yes, today we're going to be talking about rejuvenation and tonification and purification from an Ayurvedic perspective. And
So cool.
Yeah, before we jump into it, I wanted to introduce our guest. She is Anupama Kirkavitul. Welcome to the podcast, Anu.
Hello. Hello, everyone.
Welcome.
So I wanted to give a little background on you, Anu, and I know this might take me a little bit of time, but I'll try to talk fast because you've pretty accomplished. But Anu is a good friend of mine, and she is one of the champions in Ayurveda, also a champion for research within Ayurveda. So she really blends clinical and research approaches, the perfect kind of a person to move the field forward. So to give a little bit more of a background, though, Anu is a licensed acupuncturist and a certified yoga teacher and an Ayurvedic practitioner. And she studied her Ayurvedic medicine in India. And then currently she is now on faculty at Southern California University of Health Sciences. And what's really interesting about her is not only is she wonderful in the clinic, she also integrates across multiple different fields since she has the background in acupuncture, traditional Chinese medicine, and a very strong background in Ayurveda. And she's doing research that is federally funded through the NIH as well. So Anu, we're really happy to have you on the program.
Thank you. It's a great honor and pleasure to be here as well. Thank you.
Yeah, it's quite a rare breed.
So Anu, can you give us, we have other podcasts that have already talked about Ayurveda and the background on Ayurveda. And so for any listeners that want to hear about Ayurveda, you can look back at our other podcasts as well and find those on Ayurveda. But do you mind giving us a quick background on what is Ayurveda? How did it come to existence? And then maybe we can jump into this discussion around Panchakarma.
Oh, sure. Yeah. So the word Ayurveda, the word Ayurveda it's a science of life. So basically it's an ancient comprehensive system of healthcare. So which encompasses all the aspect of life. It's like body, mind, and spirit. It's all together. So but at the end of the day, what mainly matters is one has to have a happy, peaceful, and healthy life. So health is very important to achieve everything or experience everything in our life, right? So the beauty of Ayurveda is talk about how to achieve, what all are the different tools one need to have to achieve this healthy, happy, and peaceful life. So in Ayurveda, there is one point, most of these Ayurvedic classical textbook, the informations are laid out in the poem way. So there is one poem says, Dharma, Artha, Kama, Mokshanam, Arogyam Moolam Uttamam. That means to achieve everything in that life, to do the righteous activity, to achieve the wealth, everything, the health is very important. So if you look at the bigger picture, Ayurveda talk about that health, how to achieve that health. So I feel it's an ancient wisdom. It's existing since thousands of years, but at the same time, it is not an ancient, outdated science. The reason why I'm saying it is not ancient, outdated science is, if you look at the current developing scientific world of medicine, you see this terminology like holistic science, lifestyle medicine, epigenetics, nutrogenomics, etc. You won't see exactly the same terminology used in Ayurveda, but you can see these principles are explained in Ayurvedic medicine. Ayurveda all about holistic science of health. It look at every aspect of human life when we treat the disease as well as when we promote the health and wellness care. It's a lifestyle medicine. It's not just taking a pill and curing the disease. It's all about starting from waking up in the morning till you go to sleep. what all are the steps you need to follow to prevent the disease, to promote the health, as well as treating the disease. Okay, and there is concept of epigenetics you can see. There is concept of nutrogenomics you can see. Like the food is a major component of Ayurvedic medicine. Every disease you will see a separate section which talk about Patya and Apatya. The word Patya and Apatya means indicated and contraindicated food. Certain people can eat certain type of food, certain people should avoid certain type of food. So food is the biggest component of Ayurvedic healthcare as well. So you can see that the nutrogenomics is definitely thousands of years back Ayurveda has explained. So what exactly, it's a personalized medicine. That is the another beauty of Ayurveda. Like one has to take care of mind and body type before we recommend a diet and lifestyle. You have to look at those aspects as well. It's tailoring to your own body type, your own emotional type. So it is an individualized healthcare.
Now, Anu, can you talk about those types? I know a lot of people are starting to become more familiar with Ayurveda, and there's these notions of the doshas. And of course, there's a lot of complexity within Ayurveda when it comes to types and whatnot. But can you just briefly talk about the three doshas and this notion of a set constitution versus an imbalance, the Prakriti and the Vikriti? The Prakriti is the set constitution, Vikriti being imbalanced. Can you just comment on those areas just so that we have a good background before we start talking about Panchakarma?
Sure. So the Prakriti is formed, that is the constitution is formed when you are in the form of fetus in your mother's womb itself. There are so many factors influence in the formation of Prakriti. It's like external environment where your parents are living. What is their emotional state at the time of conception? What type of food they are taking? What type of activities they are involving? All these play a major role to form a constitution or Prakriti of a person. Then there are so many different type of Prakriti. I'm not going that much detail, but in Ayurveda, there is three main energies or biological energy. You can say that is Vata, Pitta, Kapha. These are the main energy which influence various functions in the body. When they are in the balanced state, a person is considered healthy. And when any imbalance happening in these three energy can cause imbalance in other like the tissues and other main basic principles like acne or digestive fire or srotas, that is the different channels in the body. So all this imbalance can happen once if doshas are imbalanced or once these biological energies are imbalanced. So these biological energies also play a role in the formation of the constitution and Prakriti of a person. Very rarely you will see the single predominant energy constitution.
Thanks for mentioning that, Anu. We're so used to hearing about, oh, I'm Vata or I'm Pitta or I'm Kapha imbalance, but it doesn't work that way, isn't it? We all have all three.
Yeah, we have a majority of, I never saw a person with the Eka Prakriti, like, we all have these three doshas, but the percentage and permutation and combination can be different. So when most of the people say that I am Vata, that means maybe I'm Vata predominant.
Exactly, right.
So that doesn't mean that Pitta and Kapha is not there in that person. So let me brief it about this Vata and Pitta Kapha. Vata is more similar to air principle. Pitta can be similar to fire principle, and Kapha can be similar to water principle. Though it's not exactly air, fire, and water.
Right.
The energy have similar quality to air, fire, and water principle. That's what these three energies. And each energy, this Vata, again there are 5 more types. Again Pitta 5 more types. Kapha is 5 more types. And each of them has different type of functions in the body. And we need all of them. We cannot just live only with one energy. We need all the three energy in the balanced way. So the key of Ayurveda is a balance. Balance is the key factor here.
So I think we got all the basic terminology, at least to be able to support this conversation. And thank you, Anu, for that.
Sure.
And I think I understood there's Vata, Pitta, Kapha, and you need to keep them in balance for a perfect life, which is what Ayurveda is about. And here I was thinking that just a nice piece of cake will give me a perfect life. Turns out there's much work to be done from sunset to sundown. So let's jump directly into panchakarma because I'm curious to hear what is it and how I can use it in my practice maybe.
And Anu, can you talk about Vikriti really briefly, since we talked about balance, but can you talk about imbalance when you bring up panchakarma, since the whole notion is to bring people back to balance?
Okay, so in a balanced person, healthy person, all these three energies, and then we have again the waste products, that is also should be in a balanced, even though they are waste products, the formation should be in the balanced way in the body. And then we have tissues, 7 tissues should be balanced, and the digestive fire, all these along with balanced in the happiness in the soul and mind. That person is considered as healthy. So now what happened in Vikriti is because of some environmental factors, maybe excessive heat, excessive cold, or raining, any of these causative factors, as well as maybe excessive work-related factors, any kind of excessive exercise, or anything which causes excessive work in the emotionally as well as physically, and also the diet. If you are eating too much food, too less food, and improper way of taking food, and contradictory food. There are so many factors when it comes to the diet. Diet itself, we can go about more than 40 plus hours from the classical textbook Ayurveda. So all these factors causes imbalance in these biological energies, imbalance in the Vata, Pitta, Kapha. That's what lead to a Vikriti. So when before any disease manifests, usually you will see some of the causative factor involved. That causative factors can be diet and lifestyle related. And that causes imbalance in the doshas. And that causes imbalance in the dhadus, Agni, Malas, etc. That's where then later it becomes manifestation of the disease. So Vikriti of a person and Prakriti of a person is two different things. Many students get confused. Prakriti is a constitution which is formed when you are in the form of fetus itself, and Vikriti is the state where you see the imbalance. That's Vikriti is the state lead to the manifestation of the disease.
Yeah, maybe we can jump into Hadar's question about panchakarma then. What is it and how does it work?
Okay, so panchakarma, the word panchakarma is 5. Pancha means 5, karma is action. It's a bio-cleansing, or you can say the purificatory method or detoxifying method. You may be seeing different terminology used to explain the panchakarma. So which has 2 effects. One is disease management effect, and second is rejuvenatory effect. So panchakarma will give 2 effects to the body. Okay, so you don't have to be sick all the time to go through the panchakarma procedure. You can be also a healthy person to have a rejuvenative effect, to promote your health and wellness. You can go through the panchakarma. So now let's see what all are these panchakarma. So as I said earlier, it's 5 karmas. So one is induced vomiting, or you can say medicated, use herbs for that. So induced vomiting, induced purgation. Then there are 2 types of enema. One is oil-based enema. Second one is decoction enema. And then nasya. So that is 5 panchakarma. So now let's see, what does this panchakarma do to our body? Just let's go with the vamana or induced vomiting. What we do in this, before we even start the induced vomiting, we give the patient about like increasing dose of ghee or oil, mainly ghee. That's what we say, like either medicated ghee or plain ghee we can give. So we are preparing the body for that. So first, we make sure the patient digestive fire, Agni, is strong enough to digest this ghee. So depend on the patient's capacity, first 3 days you will prepare that, giving some digestive herbs. And then we take that ghee, start giving the ghee, which is in increasing dose. And then the patient will take the ghee up to the point where he passes the ghee in the stool, or you feel aversion to ghee. So it's complete saturation in the body. Usually it takes 5 to 6 days to get that stage. And then next 2 days, we do the external oil application. And then sweating. Again, we are preparing the body. And now on next day, early morning, and there is a specific diet also. when patient is going through the ghee intake, and as well as when the person go through the body massage and sweating. For Vamana, there is a separate diet. You give more sweet type of food, yogurt, etc., to make the dosha utklesha. The word means to move the doshas, move this biological energy and bring into the digestive system, so that next day morning it's ready to bring it out actually. So then we give special type of herbs and then bring this toxin, whatever we brought into the digestive system, through the oral cavity.
Now, with Vamana, in the US, when they do this panchakarma, they modify it to some extent. Which ones do they use here in the US? Because I know people go get panchakarma therapies here. Which of the 5 do people usually incorporate, or are there any substitutions?
That is a big challenging question, Raja. I have seen people are doing Nasya, and I've seen people are doing Virejana. And Virejana and Nasya is, I think...
Can you explain what those are, just because people may not be familiar with these terms?
Sure.
This is like, quick one-liner description.
Virejana also similar like Vamana. So all the preparatory procedure will be same like Vamana, but instead of giving the herbs to vomit, we'll give the next morning, give the herbs to purgation. So anything below the umbilicus, any abnormality in the disease, any disease below the umbilicus, the Virejana may be the best. Or also they talk about pitta imbalance. Virejana is the best option to treat. It's more fire-related disease. Virejana may be the best option. So Virejana is a induced purgation. Vamana is a induced vomiting therapy. Then the next one is Nasya. Nasya is the oil drops, putting oil drops in the nasal cavity. So that is also, there is a separate pre-operative procedure, but that's not that much lengthy as Vamana. So we just apply the oil over the face and then give the steam, and then putting the nasal drop into each nostril in increasing dose up to particular day, then go to the decreasing dose. So usually within 7 days course, you can finish it. Vamana and Virejana and all not explained in the daily routine, but Nasya explained in a daily routine procedure. One can do this every day, 1 or 2 drop of oil each nostril. And the principle behind that, they explained that it is going to take care of all the sensory organs. And sensory organs are very important for any kind of knowledge. To perceive any kind of knowledge, we need a healthy sensory organ. So just administering this Nasya, actually it helps to nourishes some of this olfactory nerve ending, and as well as also support the various sensory organ. There is a marma actually in the cribriform plate of ethmoid bone, and below that, in that area, we have a marma. That's a vital energy point explained in Ayurveda. That is Srinkadaka marma. Which also
similar to the meridians, right? In TCM, in a way.
Yeah. In a way, you can compare that similar to meridian, where the energy points located. That's correct. Yeah. So that Srinkadaka marma is also explained as it support all the sensory organs. So putting some oilation is also helpful for nourishing the brain function, and brain is also made up of fat, right? So there is a similar thing support the similar. So oil or fat administration also support the brain nourishment. So that is another Panchakarma, Nasya. And only the Nasya, among all these 5 therapy, Nasya is the only one which is also explained in Panchakarma. But the drop doesn't want increasing dosage. That will only happen in Panchakarma, Shodhana type of Nasya. But in a daily routine, you can every day same drop, 1 or 2 drops in each nostrils to protect your sensory organs and to have very good alert and calming and peaceful state of mind.
Well, Anu, and apart from Nasya, I think the other ones that people really think about is the Bastis. Could you just briefly mention what is the role, and maybe even just globally, what is the role of Panchakarma? Is there a principle of, do you first do purification, then tonification? I mean, what is the overall principles that you're trying to follow as you enter into Panchakarma and then as you go through the Panchakarma procedures?
Yeah, so before even Panchakarma, one must pay attention to the Agni. That is the first step. Make sure the digestive fire is functioning properly, or just ignite a little bit your digestive fire and prepare the body for panchakarma, finish the detox, and then you can do the rejuvenatory therapies.
Okay, so there's a preparatory phase before you get into it.
Phase, exactly.
Great.
Yeah,
So
that's
even when
a whole new type of bowel prep.
Yeah, actually, rejuvenatory therapy in that section, it even mentioned that without doing any shodhana therapy, that means without doing any kind of purificatory therapy, if you are going for rejuvenation, it doesn't give that much result. You're wasting kind of money. So
Yeah, and it makes sense.
yeah.
Okay, then Anu, walk us through what is the intent as you enter Panchakarma, as you go through it. What in the beginning stages, what is the overall intent, just in kind of layman's terms? And then also as you move through it, what would be kind of the general principle of Panchakarma?
Yeah, so as I explained, Panchakarma can be mainly two main aspects. One is for the disease management. So if you're suffering from any type of disease, respiratory system problem, asthma, or any kind of skin condition, or any kind of digestive issues, chronic digestive issue, all this, you can also use Panchakarma as a disease management, and then take the pills, and then you can come back to the rejuvenatory measures later. Or you are completely fine, you don't have much problem, but you just want to make sure that you want to promote your health and wellness care, you want to be more active and alert and improve your stamina, immunity, etc. Then also you can do the Panchakarma. Again, that one is based on the season. There is an explanation which season, which type of Panchakarma may be the best. We can go that later. So each season specific Panchakarma also mentioned to improve your strength. Then another aspect is overall, like for example, if you, in what I see more in the West, when people are saying Panchakarma, majority of the people misunderstand or mistaken it by a preparatory procedure of Panchakarma, such as Abhyanga, Shirodhara, or like different type of Dara oil application. In reality, this is not exactly the classical 5 main therapy. But these therapies also will give some rejuvenatory effect. So
you're talking about like Shirodhara, meaning that's the classic picture of the oil being put onto the forehead, right? As someone in a resting pose.
You may, most of the people identify Ayurveda with that picture in the
Yeah,
West.
it looks very relaxing.
Yeah, actually, Japanese have done a couple of studies with the changes using the MRI and what changes happening when these patients take the Shirodhara for X amount of days. And with water, oil base, they have done some interesting studies actually.
Do you know what their findings were? I'm very curious.
Yeah, one of the study indicate that when a patient go through the Shirodhara, it is having a similar change when a person go through a deep meditation. So the height, the oil fall, the pressure, the oil fall on the forehead, all this play a role in the effect of the treatment as well. So in general, Shirodhara is indicated more for anxiety, insomnia, or some psychological problems, So scientific studies also shows that these are effective in management of these conditions.
That's very interesting. So then getting back to the Panchakarma, so as you go through, what is the end effect that we're trying to get as you go through Panchakarma? What's the overall intent of Panchakarma? What should it do to the body? And if you're coming in for something related to skin, how should it alter the way your skin is going to be reacting?
Yeah. So for the skin, I can tell there are a couple of studies actually published on effect of Vamana on psoriasis or some of the various skin condition, this Panchakarma effect actually. So the end result is, as usual, your symptoms should get better when you go, because this is a like really intense cleansing procedure. I have seen actually in my practice, after, not here, I have done the Vamana back in India. After the Vamana, the psoriasis patient, there is huge change you can see with the lesion. Okay, how the symptoms present. So definitely, I feel Panchakarma is very effective modality for management of chronic disease. But there are only certain person we have to pay more attention who is indicated and who is contraindicated for this. We don't want to say everybody can take Panchakarma.
So that's actually a really good point, because I think when we think about these procedures, it's important to know who should but shouldn't also be involved. Before you get there, just as a follow-up on the Panchakarma descriptions, so is the idea that you help take those imbalances that are present in the body, the Vikriti, and bring it back towards a balanced state? Is that the idea of Panchakarma?
That's the idea is bahu dosha. Usually when how they indicate the description, what they have explained, whenever there is too much doshas are involved and accumulated, panchakarma may be the another best option to treat the condition. So the idea here is we are taking that toxin from the extremity and bringing into the digestive system and purging it through the different direction. That is the main concept. So you are taking the toxin from the root itself, and then you will be using the herbs to treat the condition, and as well as rejuvenative herbs to nourish the body.
That's a fantastic description. Then let's get to who shouldn't be doing panchakarma. What are things that would be an immediate indication that maybe panchakarma is not right for this person?
Yeah, again, that one, Raja, it will be vary from the disease to disease.
Right.
And patient's age and the symptom. If it is really bad symptoms, too much aggravated at one point, then you don't want that patient to go through the snehana. That means ghee intake. So you may give some herbs and little bit get better, and then we'll have the patient to come for the panchaka. If the patient is having fever, we won't take that person for vamana or virejana or nasya, etc. So you have to keenly observe. It's patient to patient, symptom by symptom, age wise. So many factors are involved to talk about whether this patient is with this condition is indicated or not. Can I give vamana now or not? I don't want to give like it is not. It's like same like a Western medicine. Certain treatment how you do. It's not like a generalized 1 or 2 points saying that okay, if you are this you can take vamana. It's very hard to say. You have to have. It's a science. You have to pay attention to each and every steps of this therapy.
Yes, that makes a lot of sense. And I'm starting to get my mind wrapped around this idea of panchakarma and understanding how a person would go through this process. Now, in the dermatology practice, how can we apply this to skin conditions? Maybe you can mention a few skin conditions that you've seen that are very responsive to this. And as you mentioned, this is done for rejuvenation. So what kind of tweaks we can make in the process to really focus on rejuvenating skin?
Okay. So I have psoriasis condition, very effective. Vamana, and then eczema for skin condition, panchakarma is very effective. These are the two main skin condition I have seen in clinical practice. Panchakarma is a very effective modality. Vamana and virejana. And then sometimes what we have seen, we can alternate. We can give vamana, virejana, basti in a core, like first vamana, then after a few months virejana, then after a few months basti, depending on which dosha is predominant, how the patient signs and symptom. Patient have these signs and symptoms. And then after cleansing, definitely in Ayurveda, you can see there are disease-specific herbs are explained. So once you clean the house or clean the body, then you target. It's very easy for the herbs to go to the target point. It's much faster because you remove the clog, you remove your undigested toxin. That means you remove the ama, you ignite the fire. Your fire is or digestive capacity is working a little better. Now you target the skin condition with the specific herbs. So in Ayurveda, you can again see there are so many herbs explained to the skin condition. The herbs for supporting purifying the blood, herbs for itching, herbs for complexion, herbs for reducing the heat, reducing the burning sensation, inflammatory changes. So then based on the symptom and pathology, what is happening in the patient, then you will combine the herbs, and after the panchakarma you can administer. And then after the symptom comes under control, there are herbs which is rejuvenatory herb for the skin. You can give some rejuvenatory herbs to more nourish your skin and protect the skin, etc. And again, before I forget, I want to make sure one more thing. As I said earlier, not everybody can go through this panchakarma, even because of indication, contraindication principle, or sometimes people cannot afford, or they don't have that much time and ability to go through complete procedure also. So there we go through a different route as well. So it's not that everyone must go through Panchakarma in order to get the result, but Panchakarma will be the another best or major detoxification or biopurificatory method explained in the classical textbook Ayurveda.
Well, thank you, Anu. That was very fascinating and actually very informative. I think we are very eager to learn more about how Panchakarma can be used to improve patients' health and especially skin health. And I'm getting a sense that this is a very delicate process. Like everything in improving people's lives, you have to keep everything in balance. And we do this in Western medicine. We do it in other practices as well. So that was very clear to me, and I appreciate your comments on this. So I want to thank you very much for taking us on this trip through Panchakarma, and your expertise was certainly something that we look forward to hearing more.
Thanks for this opportunity as well. Thank you.
Thank you for tuning in to the Learnskin podcast with Dr. Raja and Dr. Hadar. Learnskin provides continuing education activities with an integrative and innovative approach that you won't find anywhere else. Become a premium member today to access our entire catalog of content, enhance your practice, and improve patient outcomes. Learn more at learnskin.com/membership.